A third of the population believe people who are grossly overweight should have to pay some of the costs of treating their obesity. That's one of the findings to emerge from the BBC's Healthy Britain survey. The poll also found that an overwhelming majority want the government to restrict fat, salt and sugar in processed food. Here's our home editor, Mark Easton.
How can people be encouraged to take responsibility for their own health and particularly a healthy diet? According to our poll, a substantial minority, 35%, think obese people should be forced to pay towards any resulting NHS treatment they need.
You know, £1.5 loss this week is good news.
Some people struggle hard to keep themselves in shape, reducing their risk of illness and saving the health service money. So should we encourage people to get fit by forcing those who don't to pay towards their NHS care?
I'm a self-confessed smoker. I mean, that is something I am doing to myself, but obesity is a difficult one.
I don't think people should be penalised because of their weight.
It's estimated that each year obesity kills about 30,000 people in the UK. Today, 1 in 5 adults is dangerously overweight. The cost to the health service is put at £500 million a year and rising.
If you've got a system that says we'll treat you for absolutely anything that happens to you with no penalty for the way in which you've lived, then where is the incentive for people not to have another burger, not to have another pint?
When top chef Anthony Worrell-Thompson discovered he had Syndrome X, a marker for diabetes, he lost weight, hired a personal trainer and now advocates radical measures to encourage everyone else to eat less.
I never thought I'd say this, but I think the government may have to tax food. Nobody will enjoy a food tax to start with. There'll be uproar. The headlines in the tabloids will be awful for the government. But I'm sure eventually people would see the benefits.
According to our poll, 4 out of 10 people want government to put extra tax on unhealthy food, while 8 out of 10 think there should be restrictions on the amount of salt, fat and sugar in processed food. The problem for government is that there is a central contradiction in our poll. People want radical action to improve public health, and yet the vast majority also say that how much people eat, drink or smoke is up to them.
Millions of people in Britain are seriously overweight, and today MPs said the government must do more to stem a further rise in obesity. The Public Accounts Committee says it's linked to 30,000 deaths each year in England alone, and the problem's getting worse. In 1980, 6% of men and 8% of women were obese. Today, those figures have trebled, and the report warns that by 2005 they'll have risen further, with dire consequences for our health.
Too much fast food and too little exercise. All reasons why we're having more problems with our weight. Obesity rates have trebled in 20 years, and today's report calls for an urgent response. Steve McMillan has sought help. His story illustrates just how easy it is to slip from being a few pounds overweight to being obese.
Being a taxi driver, I was nibbling during the day, late at night, things like that. Obviously the wrong times to eat. Never big meals, but the wrong meals.
And today's report lays bare the cost. The NHS spends £500 million a year treating conditions linked to obesity, such as heart disease. It also accuses some family doctors of being reluctant to confront the issue with patients.
The NHS has historically not been very good at managing obesity. And I think that there is an increasing groundswell of opinion that things have to change. Certainly the figures speak for themselves.
Though the figures may not be as high as in the United States, where 27% of people are obese, there are fears we could be heading that way. In France, their eating habits mean the figure's 10%. Even so, dietitians are worried.
The increase, in the prevalence of obesity in France is quite similar to the increase in obesity in every country in the world. The difference between France and the United States or France and England is that we start from a lower level.
Here, the report makes clear that teaching this generation how to stay trim has to be a priority.
Exercise is crucial if the spiralling problem of obesity in youngsters is to be halted. Every child's entitled to at least 2 hours physical training a week, but in some schools that just isn't happening.
There are genetic factors that influence our weight, but without a more coordinated approach to this major public health issue, we could be sitting on a time bomb.
Britain's preschool children are eating themselves sick with junk food like chips, crisps and sweets. Health experts warn today that our snack culture is as bad as the Victorian diet, which led to widespread rickets and scurvy. Here's our consumer affairs correspondent, Nicola Carslaw.
They're being called the couch potato generation. Research suggests 2/3 of preschool children eat a diet of white bread, crisps, chips and sweets. They don't eat their greens and they don't get enough essential vitamins. These children are fine, but the concern centres on a whole generation of preschool children whose unhealthy diets and sedentary lifestyles are storing up a host of problems for the future. Child health specialists are particularly worried about the implications for tomorrow's adults.
By the year 2030, half of all adults will be overweight or obese. And we know that that causes a lot of health problems, diabetes, heart attacks, strokes.
Tell me when. Is that too much?
It's a big problem for parents. For most of his young life, Oscar, who's 5 years old, has picked at food, eating little or nothing other than sweets and milk. His mum says only after professional help are mealtime battlegrounds becoming a thing of the past.
We were advised that we should not bribe him to eat, but to give him small rewards when he did eat. Because I was finding that I was actually giving him sweets just to see him consume something.
A balanced diet, an active lifestyle, not exactly new concepts, but clearly the messages aren't getting through, failing today's generation of kids.
Television adverts for unhealthy food could be banned from daytime and early evening television in a new effort to tackle childhood obesity. The government wants them to be shown only after 9 o'clock at night, but critics say banning adverts would do little to change children's eating habits and that should be left to families.
All schools should do at least 2 hours sport a week to fight obesity. That's one solution according to the government. Here in Frinton-on-Sea in Essex, pupils are also getting advice on health awareness about good and bad dieting.
What are the things we need to cut down and eat not very much of?
Chocolate.
Chocolate.
Butter and sausages and stuff.
These fatty foods, junk foods, have helped create a generation in which 1/3 of children are overweight. A more sedentary lifestyle, too much sitting in front of the television and playing computer games are also to blame. But the problem is getting worse. Now some 17% of 5 to 15-year-olds in England are officially obese. A further 15% are classed as overweight. So what are the possible solutions? The government is considering a ban on junk food advertising on television before the 9 o'clock watershed. This would affect products high in fat, salt or sugar. Adults can make up their own minds. But the Conservatives don't believe a ban on advertising is the answer.
We don't need more of these nanny state kind of legislation. The industry is working on this. The industry is working on removing smoking in public places. The industry is working on a system of labelling foods so that people can put together a good diet. We don't need all these bans.
Further details about the government's plans to reduce obesity are to be announced in a white paper on Tuesday. But government ministers are being warned that if they fail to bring childhood obesity under control, the cost to the NHS in treating related illnesses could escalate even further. Tonight, there are also questions over whether the sort of advertising ban that's being proposed will have any impact at all. John McIntyre, BBC News at the Department of Health.
Children are getting fatter at a younger age. Doctors' leaders say 1 million children under 16 are now obese. The British Medical Association says urgent action is needed and it wants a ban on junk food adverts which are aimed at children. Alison Holt reports.
Alex is 13 and a mad keen footballer, but 2 years ago it was very different. He was overweight and his confidence was so low he didn't want to go out. His mum was worried. She was happy with her weight, but he wasn't with his.
Being overweight and lack of confidence together combined can
become an issue, and I didn't want it to be. So if I couldn't change his personality, I wouldn't want to, but I just wanted him to feel more confident.
Today's British Medical Association report calls for radical action to help the growing number of young people with a weight problem. For Alex, a course with other young people worked.
It made you confident, and being around with other people like you makes you more confident.
What kind of foods are good for us?
This was the course that helped Alex. The BMA says with 1 million obese children in the UK, there needs to be more specialist programmes like this. Here, the whole family is involved.
Georgia? There's no point putting a child on a special diet, giving the child different food while the family eats other food. We all know that that doesn't work. So it's about the whole family trying to be more healthy, eating better, and also trying to be more active.
And the role schools play is vital, according to the BMA. It wants more playing fields and more emphasis on eating well. The report says children should be encouraged to drink more water and milk. Fruit and veg should be subsidised, and vending machines with sweets banned from schools. It also wants a ban on junk food advertising. The BMA make it clear to halt this epidemic in childhood obesity, much more must be done to improve what children eat and how they exercise. Without it, they warn, the long-term damage to the health of the next generation will be serious. And tomorrow, the National Heart Forum publishes a report also demanding better food in schools. But doctors say obesity is a problem about which no one can be complacent. Alison Holt, BBC News.
Now, you may remember back in February we told you about a new scheme in Hull to take burgers and chips off the school menu and replace them with healthier food. Well, it seems the children of Hull aren't too keen on the idea, and now fewer children are having school meals than before. For tonight's 6 special report, Richard Bilton has been back to Hull to see why they've been turning up their noses at the healthy helpings and what schools are doing about it.
Really bad, mate?
Yeah.
Yeah?
My drink in my bag.
Alicia Johnson has been a bit left behind by Hull's health revolution. Okay. She now takes a packed lunch to school because she didn't like the healthy alternatives and was eating nothing all day.
I would rather eat that than school dinners because that's more tasty than school dinners.
I agree on the healthy option, but I think in the consultation with the children and the parents and looking what they do like, I think it's gone too extreme, too fast. It was 2 months ago that primary schools in Hull saw their menus change. In came veggie burgers and fish cakes, good for you, but for many, a bit of a shock to the system.
The new menus have had a big reaction across Hull. In fact, the demand for school dinners at Hull's primary schools has fallen 10%. But what the city is trying to do is fight a major problem. Nationally, 1 in 12 6-year-olds is obese, dangerously overweight. And that is a condition that can take 9 years of someone's life expectancy.
And from today, all these children will get their healthy meals for free. And first up, a not very healthy looking pizza and chips.
A lot of the children found it difficult. They're eating things they weren't used to. So they've tried to come to a compromise, a balance.
It seems to be a fairly fudged compromise if they're getting pizza and chips.
But it's a healthy pizza. It is a healthy pizza.
So there you go. There was also salad and fruit juice. And TJ and Samira Morfitt like what they're seeing.
I like the mash. You know that pie we have, I like that. It tastes good and it's healthy for your teeth and your body.
There have been arguments this school scheme will cost £7 million over the next 3 years, but the head teacher here says it's worth it.
I know that it's very difficult sometimes to encourage your own children to eat the right things. I think school has a vital role to play in presenting children with options and choices, and one of those options and choices is a healthy meal at lunchtime.
At home tonight, just a snack for TJ and Samira. Their main meal is now at school. The system here is still not perfect, but there are plenty watching this city's attempts to change what our children eat.
Every year, more than 4 million people in Europe die from heart disease, and our chances of surviving the disease varies greatly depending on which country we live in. In Western Europe, Britain has one of the highest death rates. So what's being done to improve heart care? But first, our health correspondent Jill Higgins examines why the situation is so bad in Britain.
Women in Glasgow have the highest rate of heart attacks in the world. It's partly because of bad lifestyle. So patients here in the busy coronary care unit are now given lots of advice on how to eat and how to keep fit.
You're frightened before to do any exercise in case you did any damage, but now under supervision it's made all the difference in the world.
Apply pads to patient's bare chest.
Today's report says we have to do more to improve lifestyle. If people don't change their habits, heart disease rates will continue to rise. And that's not great, as we have problems with treatment here too. Waits for operations are far too long. Gladys Griffiths is getting a pacemaker fitted today, but she's suffered 4 months of being constantly out of breath.
Well, I haven't been able to go out, you see, unless somebody sort of took me out in the car, or I'd just go up the road, but somebody had to go with me, because I couldn't walk too far, I got out of breath, you see.
If you have a stressful job, you're twice as likely to die from heart disease than people in less demanding occupations. Researchers in Finland studied several hundred healthy men and women working in the metal industry over a 25-year period. They found that employees working long hours in low-paid jobs with little opportunity for promotion are at much greater risk than satisfied workers.
And remember, you must tell us if you feel any pain.
It's all go at this rapid access clinic for chest pains in London. It's in constant use, as the UK has one of the highest rates of heart disease in the world. Now, a new study in the British Medical Journal says one of the reasons for the high level could be stress at work. Bill Thompson's had 2 heart attacks. He thinks smoking and 40 years as a London bus driver are probably to blame.
And you're in traffic, you're going through the city of London, you know, and people are queues everywhere at times, especially peak hour, and I find it a very stressful job.
With today's pressure to perform, many could be at risk. The study looked at 800 factory workers, but it's the same for anyone faced with high demands but little feeling of control, low salaries and few opportunities to get on. The Finland research showed this stress doubled the chance of dying from heart disease. Experts here in Britain are taking notice.
So now such patients will be promptly referred to hospital, get the tests they need, get the treatment they need, because we now have an increased awareness of their risk of getting heart disease.
Now, there's a lot of emphasis on what you can do yourself to prevent heart disease. Stop smoking, eat more healthily and do more exercise. That's all vital, but clearly there's an important role for employers too. If they can effectively tackle stress in the workplace, it could mean fewer people having to come for treatment here. Jill Higgins, BBC News.
Hello, first up, fatal sun damage. Experts are warning the rate of skin cancer in Britain could treble over the next 30 years, with children now 3 times more likely than their grandparents to develop it. So why is it on the rise, and what can you do to protect yourself? We all love to get out in the sun. It's warm, it's relaxing, and it can be good for you, but only in small doses. Because if you sunbathe without taking the right precautions, it can turn deadly. When you get a tan, your skin is already damaged. It means something called melanin has been produced in your body, which is trying to protect you from harmful UV rays in sunshine. Those rays can cause cancer. Research out today reckons rates of skin cancer are on the rise and will keep going up for many years. Children are especially vulnerable.
Although skin cancer is rare in childhood, research suggests that sunburn in childhood can actually double the risk of skin cancer later in life.
It's hard to avoid the sun altogether, so what can we do to protect ourselves?
You can make sure that your skin is never burnt when you're out in the sun, and also the sun's hottest between 11 and 3 p.m, so it's a good idea to stay out of the sun, and also to wear good clothing like t-shirts and a hat and sunglasses, and also always wearing sunscreen.
Now the weather's getting warmer, it's nice to be outside in the fresh air. Just make sure you're safe to have fun in the sun.
They're called bedheads, the teenage girls who use sunbeds nearly every day. Like smoking, it's seen as cool, but like smoking, it carries a health risk. Overexposure to ultraviolet light damages the skin and can lead to cancer. Yet there's no law stopping under-16s from using sunbeds. For tonight's 6 special report, Richard Bilton has been to meet the teenagers chasing the perfect tan.
Kelly, can I use that, love?
Kerry, Laura and Steph are getting ready for a big night out.
Coming off my face.
They're all in their early teens and how they look is crucial. The must-have is a tan.
So there's 10 of us in school, isn't there? And every one of them goes on the sunbeds. Everyone. Even the kids in like year 8 and that's like 12-year-olds are going on the sunbeds now.
As adults, we know the risks of skin cancer. We can make our own minds up. The worry is under 16-year-olds who want to tan and use sunbeds, because the problem is they're the ones most at risk and there's nothing in the law to stop them. This is Hayley, and she accepts she's obsessed by her tan.
I'd rather not be like that.
She is 13 and she uses a sunbed 4 or 5 times a week.
When I haven't been on, like one day, I feel like I feel white. I feel like transparent.
Has it ever made you ill?
Yeah. I come off and I couldn't hear nothing and I had all black dots in front of my eyes.
She just like, it's that obsession. I think it's like, I've put it down to an illness with her now.
A study by Newcastle University found around 100 people a year in the UK die as a direct result of sunbed use, and experts say under-16s should stay clear. Now, we have met a 13-year-old girl who uses sunbeds 4 or 5 times a week. What do you think of that?
I think that's absolutely unbelievable. I mean, it really is staggering. That young girl is destined to almost certainly develop skin cancer later in life.
So we took Hayley to a clinic that can assess her skin, a camera that will look for damage.
I'll take different shots of your skin. This is the UV light, so this is the one that's going to show us the skin damage, the skin sensitivity and things like that, okay?
Salons are advised by their trade association not to allow under-16s on a sunbed, but there are no laws. Hayley never had a problem, and this is what she has done to her skin.
Under the eyes, it shouldn't be this dark for your complexion. The amount of freckles that you can see on her face, the intensity of the freckles, the darkening of the skin as well with the UV light, shows a damage to the skin. Hayley's damaged her skin.
I didn't know it did that much damage to my skin.
She didn't know what she was doing. Seeing the damage that she's done, it's horrendous. It really is. It shocked me and it's upset me.
Cancer Research and the British Medical Association have both called for tighter regulation, but at the moment there is nothing to stop more teenagers like Hayley putting themselves at risk for a tan. Richard Bilton, BBC News, Liverpool.
More women in Britain now die from lung cancer than breast cancer. New figures show female deaths from lung cancer have risen nearly 40% in the last 20 years, while the number of women dying from breast cancer has fallen slightly. Smoking's being blamed for the increase, as our health correspondent Richard Hannaford reports.
The rise in the number of young women smoking has continued to increase despite the dangers. Today's report reveals that lung cancer now kills more women than any other form of the disease. Yet even with these figures, many women find it hard to give up.
Yet another deterrent, but I don't know how I can stop. It's too addictive, too easy to come by, and willpower's not enough.
I've thought about giving up smoking and that. It's just like when I get stressed at work and stuff, I need a fag.
Now, this is a fairly young lady.
Over the past 2 decades, Professor Ian Smith, head of the lung unit at the Royal Marsden Hospital in Surrey, has seen the number of women needing treatment for lung cancer rocket. This woman in her 20s was a smoker. She now has a tumour in one of her lungs.
Now I would say virtually half the patients in our clinics are women, and not just elderly women, middle-aged women as well, wives, mothers of young children sometimes. So it's a very real problem, it's a terrible problem.
Previously, more women died from breast cancer. Today's report shows that's changing. In 1979, more than 13,000 women died from breast cancer. Last year, that had fallen slightly to just over 12,600. 20 years ago, fewer than 9,000 women died from lung cancer. Nearly 13,000 women died from the disease last year, a rise of 36%. Campaigners at the Labour Party conference are highlighting these figures. They want more awareness of the problem as the government prepares to publish its national cancer plan.
They need to take the same attitude to breast cancer with the ribbons and the awareness and the screening and apply that to lung cancer.
But while women continue to take up smoking, experts believe the figures will remain high for some time. Richard Hannaford, BBC News.
Scientists are investigating a possible link between a substance called acrylamide and cancer. The chemical occurs in starchy food cooked at very high temperatures, and tests suggest it could be cancerous in animals. Now scientists around the world are investigating its effects on people. One state in America is even considering a move to make fast food outlets carry public warnings about acrylamide. For tonight's special report, Adrian Addison looks at the chemical that's challenging the scientists.
The World Health Organization, the US Food and Drug Administration, our own Food Standards Agency. There are over 200 research projects ongoing across the globe into the potential cancer risk of a chemical called acrylamide.
Food away!
In the meantime, we're eating it. Few people think deep-fried food is good for their figure, but it could be doing more than just making us fatter. Scientists fear it could be a cancer risk. The design of these fryers hasn't changed in 50 years.
They were designed basically as a vat to hold the oil and let as much heat as possible go into the oil and have a huge sediment zone at the bottom where all the debris could fall to the bottom. And this is what we get, food cooked and overcooked.
Auger has made fryers for decades, but they've now designed a new machine after their own research showed high levels of acrylamide found in food cooked in old fryers.
Most restaurants will not know what acrylamide means. They don't know that leaving food within the oil and cooking it time and again actually can create a harmful substance.
There are more than 500,000 of those machines frying away across the country every single day of the week. Now this is some sediment we found in one fast food takeaway which had built up over a 3-day period. It's full of acrylamides. Now it's not just that black sludge. Acrylamide occurs in carbohydrates cooked at very high temperatures, even in the home. That's foods like chips, crisps and cereals. It's used as a grout in sewers, and it caused nerve damage in people exposed to it at work. Rats fed on a diet of overcooked fatty foods developed cancer.
The whole issue of acrylamides in foods is entirely new. The International Agency for Research on Cancer, that's the UN-approved body based in France, rates acrylamide as a very serious, dangerous entity. We do not want it anywhere near us. My advice is very simply avoid acrylamide delivering foods. Avoid those fatty foods that have been cooked at high temperatures.
Food away, please. The Food Standards Agency watches over what we eat. They have not issued warnings against acrylamide.
A lot of the work that we're doing at the moment and is being coordinated across Europe and with other international bodies is looking at ways of reducing the formation of acrylamide during the cooking process.
It'll be years before research defines the true size of the cancer risk of acrylamide in food. In the meantime, we can choose to avoid them, or not. Adrian Addison, BBC News.